We were all devastated by the death of 2-year-old Jordan Beliveau last year. He died after a blow to the head, allegedly at the hands of his mother. Now we're trying to take what we've learned from his death to improve outcomes for children in the future. And I'm grateful to the Statewide Guardian ad litem program, the Florida Department of Health, and Dr. Bruce McIntosh for creating this training for volunteer child advocates. It's designed to show Guardian ad litem volunteers how to recognize abusive head trauma when they see it and what to do in those situations to protect children from further injury. Last session, I filed a bill known as Jordan's Law, requiring this training for Guardian ad litem staff and volunteers, along with other professionals in the child welfare system. It didn't pass, but that is not stopping the Guardian ad litem program and the Department of Health from doing the right thing. It is never too late to do the right thing, and I'm grateful to know that we are taking this giant step forward as a state.
Hello, I'm Dr. Bruce McIntosh, Statewide Medical Director of the Child Protection Team System. Thank you for joining me for this discussion of what you, as a Guardian ad litem, can do to support the best possible outcomes for children who've been victims of abusive head trauma or are at risk for that kind of injury. What we're going to do today is to review some statistics on how common it is and what kinds of children are victims of it. We will discuss mechanism of this injury and the clinical findings that go along with abusive head trauma. We'll establish the fact that it is a real thing because you will hear in social media and on popular TV shows a challenge to the whole concept of abusive head trauma. We'll discuss what medical personnel do to confirm the diagnosis of abusive head trauma. And in closing, we'll review your role as Guardian ad litem in helping to protect victims of abusive head trauma from further injury. Now, first of all, to demonstrate to you that abusive head trauma is a real thing, the original article about it was written by Dr. John Caffey in 1974. It was entitled "The Whiplash Shaken Infant Syndrome." It is common for defense attorneys and family attorneys to present the idea of the shaken baby syndrome as an unproven theory or speculation. It is not. It is a fact. Dr. Caffey's article was based on statements of people who described what they had done to their infants before their infants lapsed into unconsciousness in their hands. At a time when it was not widely appreciated how dangerous it was to violently shake babies, people would tell their doctor, "He was crying, I shook him, we went to sleep and he didn't wake up the next morning," or he stopped breathing. So this is not a theory, this is a fact based on originally confessions. Subsequently, there have been hundreds of remorseful confessions of other people who've described what they did before their baby lapsed into unconsciousness. You will hear claims that it's been proven that it's impossible to shake a baby to death. That is a false claim. It cannot be proven because there's no model that accurately represents a human baby. What is abusive head trauma? It's an injury to the head or the brain, and the emphasis is on the brain of an infant or a child younger than 5 years of age, usually as a result of violent shaking plus or minus blunt force impact. The National Center for Shaken Baby Syndrome estimates that each year there are between 1,200 and 1,400 children who are injured or killed by abusive head injury. It's the primary cause of death and disability in infants that resulting from child abuse. Right here in Florida, in between the years 2014 and 2018, there were 91 children who died as a result of abusive head trauma. That's about 18 per year, a number that we would certainly like to reduce. Why do caretakers do it? Well, there are a variety of reasons. The most common is colic and crying, and we will talk more about that in a moment. Those are the most common causes in the first 2 months of life. Later, as children get older, 8, 9 months of age, some babies continue to cry at night to be fed or just simply to be given attention by their parents, and parents sometimes lose their temper with those crying babies. Separation anxiety is that anxiety and crying that occurs when somewhat older children are being left at daycare or babysitters by their parents. Normal exploratory behavior. When children begin to be able to creep, cruise, or crawl, they are driven to explore the environment. If they find something, they will pull it down. They will see what happens if it drops. They will see if it tears. They will see if it fits in their mouths. Many parents see that normal exploratory behavior as a misbehavior and overreact to it. As children get into the second year of life, they often start saying no, which is a word that they hear so much during that first and second year of life. This is a normal developmental stage that many parents see as misbehavior and resistance. Again, they may overreact. Picky eating. Parents will seriously injure children simply because they don't eat what the parents want them to eat. And then as the second year closes and parents start working on toilet training, many children are seriously injured or even killed because they don't make progress with toilet training at the rate their parents will. Let's go back to talking about crying, though. Why does that happen? Well, you have a caretaker who's taking care of a baby, sometimes during the day, often at night, and the baby's crying. The caretaker tries to do what the baby wants, tries to make the baby quiet, but the baby continues to cry. The caretaker tries changing the diaper, tries feeding, trying burping, but the baby continues to cry. The caretaker tries something else, but the baby continues to cry until finally there's nothing in that caretaker's world except that crying baby and the anger and irritation and frustration that comes from having to deal with that crying. In anger and frustration, they lose their temper and they often violently shake that baby. We're not talking about gentle jiggling. We're talking about shaking with a degree of force that any other person seeing it happen would say, "No, wait, stop, you're going to hurt the baby." A degree of force that's obviously an attack on the baby. When this happens, the baby's head slams back and forth and the brain slams back and forth within the skull, causing damage of the sort that I will talk more about in a moment. Some people claim that it's necessary to impact the baby's head to cause brain damage. It certainly helps, but it's not necessary. We do know from confessions that babies can be brain damaged simply from violent shaking. This is a study that reports what perpetrators admitted to doing. It involved 81 cases of abusive head trauma. In this series, 71% admitted shaking the baby. 46%, or about half, admitted to shaking alone. 29%, about a quarter, admitted to impact alone. 25% admitted to shaking and impact. Now, it's important to understand that if you are standing by a crib side and slam a baby's head on the crib mattress, there will be impact, but there will not be bruising or a skull fracture. If you slam the baby's head on the wall or the floor, there will be bruising or a skull fracture so that we can tell that there's been blunt force impact. But if you slam the baby on a couch cushion or a crib mattress, there's no bruising, no fracture, so we can't tell which babies have simply been violently shaken and which have been impacted on some soft surface. It's important to note that none of these children were reported to have acted normal after the event. This is confirmed in many cases. Many reports document that infants who've suffered serious or life-threatening brain injury don't act normal. That is what allows us as medical personnel to determine who was with the baby at the time the baby was injured. Almost half of them admitted to shaking alone, and none of them acted normal after the event. It's important to understand that it's not usually the perpetrator's intent to kill or injure the baby. The intent is to punish or to quiet the child. Some perpetrators get very good at giving concussions. It becomes their habitual response to the crying baby to shake him until he becomes quiet. And at some point, he gives them a harder shake than at other times, causing the baby to have a brain injury that brings them to medical care. When they're brought to medical care, they're often found to have older injuries from this prior abuse. They have older broken bones, they have older areas of bleeding inside the brain. So it's important to understand that while they don't intend to kill or injure the baby, they do intend to shake or slam the baby, so they are responsible for the consequences. It's not necessary for them to intend to kill or injure if they intend to do the thing that causes the injury. Who does this? Well, you can see from this pie graph, you can see the tan area, the red area, the black and the blue area. Those are males. The father is the most common person to do it. Mother's boyfriend is also common, but males are more likely to be able to do it. But it's important to notice that purple and gray area are the mother and female babysitters. They also have the upper body strength to do this. So women can, as well as men, inflict abusive head trauma. They can also be very nice people in any way other than the injury they caused to their child. These people often have no problem in any other way except in dealing with a crying baby in the middle of the night. When you talk with them, they will be very cooperative, they will be very nice. You will find yourself thinking, this person could not possibly have done what the experts say they did to this child. Well, if I had abused my child, I would be the nicest person you talk to the next day. Do not let them persuade you that they didn't hurt their child if the medical evidence indicates that they did, simply because they seem to be nice people. There are risk factors for abusive head trauma. There's quite a list of things that set children up for them, but there are some families that are upper middle class families, two-parent families, no other stresses, where it still happens. One reason you need to be aware of this list of risk factors is that if there's a plan to reunite the child with the family, any underlying risk factors need to be addressed. If there's a mental health problem, that must be addressed before the child can safely go back. If there's domestic violence, that needs to be addressed. If there's drug use, that needs to be addressed. If there's a medically complex child, that child's medical needs must be addressed. So any underlying risk factors that set up the family for abusive head trauma need to be addressed before that child can be safely returned to the home. Let's talk now in more detail about exactly what happens when the child is shaken or slammed. This is a picture that shows the brain and its surrounding membranes. The skull would be outside that dark line that surrounds the brain. That dark line represents the dura, a tough membrane that helps protect the brain. The brain floats in a pool of spinal fluid, which allows it to move a little bit forwards and backwards. And as the baby is shaken and slammed, the brain moves backwards and forwards. Up in the dura, up in that tough membrane, small blood vessels are torn that allow blood then to leak out over the surface of the brain, causing what we call a subdural hematoma. This bleeding is easily seen on CT scans. We have here a list of the things that happen that contribute to brain damage, and we've discussed impact trauma and that bleeding, which is easily seen on CT scans. Another thing that happens, however, is torn nerve fibers deep within substance of the brain. This illustrates that area. As the brain slams back and forth, nerve fibers are torn deep within the substance of the brain. This is what makes the baby go unconscious and stop crying. This is often the most serious part of the brain damage. The bleeding is obvious. This is not so obvious, but this is what causes the baby to go quiet. The damaged brain then begins to swell, and that makes it difficult for the heart to pump blood into the head. That results in a lack of oxygen to the brain, which makes the brain damage even worse. At this point, I have to throw a big term at you. I apologize for that, but you need to know this term because you're going to find it in the medical reports you'll be asked to review. That term is hypoxic ischemic encephalopathy. It's not actually that bad when you unpack it. The term hypoxia means a lack of oxygen. Ischemia means a lack of circulating blood. Encephalopathy means brain damage. So hypoxic ischemic encephalopathy is simply fancy language for brain damage resulting from a lack of blood carrying enough oxygen to the brain. There are a number of causes of this. One of the most common causes is apnea, that is the cessation of breathing that results after abusive head trauma. It is very common for a baby who suffered abusive head trauma from shaking or slamming to stop breathing. And parents will often delay calling for medical attention because they're afraid that someone will start asking hard questions. So they let the baby struggle to breathe inadequately for a while before they call 911. That lack of oxygen often causes brain damage worse than the original brain damage from the shaking and slamming. Hypoxic ischemic encephalopathy can also be caused by choking and strangulation, which may be due either to abuse or accidents or neglect. Drowning is another common cause when children are pulled from a swimming pool after a few minutes. They may survive, but they may survive with brain damage. And then suffocation, which usually results from negligent bed sharing. These are all possible causes of hypoxic ischemic encephalopathy that may come up in other cases that you deal with. I need to share a few medical terms with you, again, because you will need to understand these when you read medical reports. The first term I'm going to discuss has a perhaps distressing picture of an injured child. If it's going to distress you to see it, please look aside for a moment, and I'll tell you when you can look back. A contusion is a bruise. Contusion is simply fancy for bruise or bleeding into the soft tissues such as the skin. Now, a child who's had his head hit or slammed against hard objects will have bruises like this, but a child who's been slammed on soft tissues, soft surfaces, will not. Okay, you can look back again. Cerebral contusions are contusions to the brain. The arrow points to a white area of fresh blood over the surface of the brain, where the brain has been bruised by slamming against the inside of the skull. A cephalhematoma is a collection of blood outside the skull under the scalp, often visible to other people. This can result from a skull fracture. These may be due to accidents or abuse. A subdural hematoma is that blood that I've referred to earlier, which is layered out over the surface of the brain, shown here in white. That is fresh blood over the surface of the brain inside the skull that results from the torn blood vessels as the brain has sloshed back and forth inside the skull. Epidural hematomas are blood that come from torn arteries. About half of these are due to accident, about half of these are due to abuse. They are different in their appearance on CT scan. All of these terms may show up in medical reports that you'll review, and now you're familiar with them. It's important, if you're going to be an effective advocate for the child, that you not be taken in by false claims that are offered to explain away an abusive head injury. There will be the claim, again, that it's impossible to injure by shaking. We have hundreds of confessions, so we know that you can kill or injure babies by violently shaking them. Short falls. It is often claimed that babies will suffer serious head injuries by falling off beds or couches. Let me go to the next slide a moment to discuss that. There are multiple studies that look at what happens to babies when they fall off beds and couches, and it's well documented that while they may get bruises, they may even get a simple crack in the skull, they do not get serious underlying bleeding or brain injuries from these falls from beds and couches. So do not believe that a baby who's in the intensive care unit suffered that injury from falling off a bed. Others will claim that the baby gagged or choked on a feeding, experienced lack of oxygen for a short time, and bled into its brain because of that. That's not true. If a lack of oxygen caused bleeding into the brain, then we would find it with drownings, and we don't see it with drownings. There will be the claim that the baby had an earlier minor injury and then later had another minor injury that caused bleeding into the earlier injury. That does not happen to such an extent that it's going to cause the baby to suddenly go unconscious. Other false excuses will be reactions to immunizations and vitamin deficiencies. These have both been thoroughly investigated and do not hold any water as explanations for serious brain injuries in children. How's the outcome of children with abusive head trauma? Some die immediately. They're dead on arrival. Others survive a short time in the intensive care unit, but then die. You're unlikely to be involved in those cases, except cases involving siblings of those children who may need protection. Some children survive with severe deficits, others survive with relatively minor deficits. Some children appear to be normal, but you never know what capabilities they have lost. Maybe they were going to win a Nobel Prize, but now they're simply going to graduate from high school. Maybe they were going to be an Olympic athlete. Now they are a little bit clumsy and never excel in athletics. You never know what they have lost, even if they seem normal. Looking at those children with more severe injuries, results can be total or partial blindness, either from damage to the eye or damage to the part of the brain where vision occurs. Developmental delays and mental retardation are common, as are convulsions or seizures, and partial paralysis of part of the body, cerebral palsy, and hearing loss. Many of these children will be profoundly handicapped, even if they survive their injury. It may be that you are visiting a home where there has been a child who may have suffered from abusive head trauma or some other kind of injury. You might have an opportunity to notice something that is an indication that this child has suffered a new head injury. But some things that may jump out at you if you have the opportunity to see them are lethargy or sleepiness, decreased level of consciousness, less interaction than usual, sleeping more than usual. Any of these things might cause you to be concerned that the child has suffered a new head injury, and would be a reason for making a report to the authorities that the child needed to be examined and investigated. A takeaway point here is that if you visit a home, you need to see the children awake and alert, because there might be a child unresponsive in the back room if you don't take a look at him. There are what are called sentinel injuries. These are other things you can look for, relatively minor signs of injury and from abuse that may not seem too impressive, but that identify infants that are at great risk for future serious or fatal injury. These are most common in children less than 7 months old, though they also occur in children up to 2 years of age. Recognizing and reporting these sentinel injuries, as they're called, that need to be investigated, can help prevent death and further disability in vulnerable children. This is a busy chart. I'm only going to speak to one part of it, dealing with those children less than 6 months of age. Bruising is a sentinel injury in young infants. Until infants are old enough to get up, to pull up on furniture, to cruise around the edge and fall and bruise themselves, they're not able to get bruises on their own. There's an old saying that those who don't cruise don't bruise. So any bruise on a non-mobile child, any bruise on a baby who simply lies there, has to be the result of something an adult caretaker did. Either they abused the child or they negligently left the child where the child could fall and be injured. So any bruising on an infant less than 6 or 7 months of age needs to be reported to the authorities. Burns, likewise. Infants who simply lie there can't get themselves to any hot object to burn themselves. Any burn, a curling iron, cigarette, hot liquid, any burn on a young infant needs to be reported so it can be investigated. Oropharyngeal injuries are injuries to the mouth. You will not have the opportunity to look into the baby's mouth, but any bleeding from the mouth or a history of bleeding from the mouth of a young baby needs to be reported. These occur when parents lose their temper with a baby who won't take a bottle or won't eat, and something is forced into the child's mouth. Injuries to the mouth in young infants identify babies who are at very great risk for other injuries. What do you do if you notice a new injury on a child? Florida law requires that anyone who knows or has reasonable cause to suspect that a child has been abused is required to make a report. You don't have to know for sure. Ascertainment for certainty often requires a more thorough investigation by a medical specialist. Suspicion is enough to make that report. You make that report by calling the hotline, 1-800-96-ABUSE. You cannot be successfully sued if you make that report in good faith. Department of Children and Families is required to report these injuries to the child child protection team, so that they can be more thoroughly investigated. What is the Child Protection Team? The Child Protection Team is a statewide system of medical specialists with special training and expertise in child abuse who will conduct a thorough investigation of that child to determine whether or not what appears to be an injury is an accident, abuse, or some natural medical condition. They will review the medical history, they will conduct a physical examination, they will consult with others caring for the child, they will review studies that have been done, such as CT scan and x-rays and blood studies. They will consider other possible causes, such as accidents, medical conditions, before arriving at a conclusion that the child has been abused. You can be sure that any case in which you are involved that has been ruled to be abuse has been thoroughly investigated by medical specialists in the field, and that has been ascertained to be due to abuse. In summary, let's discuss your role as a guardian ad litem in working with these cases. First of all, you have the duty to report any new injuries you observe that are suspicious for abuse. You need to obtain and review all the relevant records on the case so you are knowledgeable about it. And you need to try to speak with the medical providers, especially the Child Protection Team person, who can tell you more about the nature of the injuries and the level of certainty that they are due to abuse. You need to not allow yourself to be taken in by false denials or false theories of causation by the parents themselves, by their attorney, or by a medical expert they may retain who offers one of these false explanations. You need to be an advocate for the best interest of the child. You're not on the side of Children's Legal Services, you're not on the side of the parents, you are on the side of the child. You are the child's voice when the child cannot speak for himself or herself. You also need to ensure that all recommended treatment plans are followed, such as the mental health referral, the referral to medical specialists, follow-up with medical specialists, domestic violence intervention, drug program rehabilitation. You need to be sure that everything needs to be done to protect that child going forward. In this way, you can help ensure the best possible outcome for the child. I'd like to thank you personally for all that you do as a guardian ad litem to help ensure the best possible outcomes for the children in the cases with which you work. This is difficult, demanding, often stressful work, but it's extremely important. So thank you for all that you do on behalf of children.